the physiological regulation of blood vessels, what we're going to do is we're going to take a look at how the lumen of the blood vessels will be regulated and how that regulation is going to affect the overall function of the system. So the system is going to be based off of dynamics of fluid movement and fluid movement within a tube. What we have to remember is that fluid is going to be moved based off of internal and external pressures between the fluid and the lumen itself. When the fluid is going to move, it's going to move based off of a parabolic motion. This parabolic motion is going to increase and decrease friction based off of frictional pressure between the fluid and the luminal tissue itself. What this means is that the central part of the fluid will be moving much faster than the outer part of the fluid. The other thing that we have to look at, particularly within the blood vessels, is those things that do not get dissolved within the water environment will be propelled upward and outward, in particular the lipids, and in particular the large lipid molecules such as lipoproteins, the LDLs, the VLDLs, and the HDLs, which will then interact with the luminal tissue, and interactions with the luminal tissue is what's going to ultimately bring about the atherosclerosis that can occur within the arteries. So if we look at the arterial lumen itself, what we end up having is we end up having a contribution of external compression from the tunica media muscle and the internal fluid pressure pushing back against that external pressure. What this is going to do is this is going to propel those non-soluble materials laterally away from the central line of flow, and it's going to ultimately lead to that increased friction between the fluid and the luminal wall itself, or the luminal tissue itself. This is going to be different than what we see with the vein. With the vein, there is no external compressive force. The only force that's going to be seen is going to be seen between the fluid pressing itself outwards based off of the total volume within the fluid itself. This is why we have so much volume on the venal side of flow versus the arterial side of flow. In general, we have a relationship in which a change of diameter within the lumen is going to lead to a change of fluid pressure based off of the compressive nature and the rebounding of the compressive nature between the luminal tissues and the fluid itself. Generally speaking, this is going to be inversely proportional. It's inversely proportional based off of an increase of diameter leading to a decrease of pressure and a decrease of diameter leading to an increase of pressure. It's explained based off of the Hagen-Poiseuille equation, where change of pressure, delta P, is equal to 8 times the viscosity of the fluid times the length times the volume of flow, all over pi times the radius to the 4th power. In general, there is no change in the length of the tube, the volume of flow, or the viscosity, which simply means that what we end up having is a change of pressure is going to be equal to 8 over pi r to the 4th, which means that any small change in the radius will lead to a drastic change in the pressure. We can also look at based off of the rate and the flow of movement within the lumen, where the flow rate, Q, is going to be equal to the change of pressure times pi r to the 4th over 8 viscosity times the length of the lumen. And once again, the length of the lumen and the viscosity will not change very much in normal conditions. Therefore, a very small change of radius will lead to a drastic change in the volume of flow. Additionally, velocity and the force of fluid is going to be proportional to the change of pressure, based off of the equation of force equals velocity times pi r squared, where whenever we have a small decrease of the radius, we're going to end up having a large increase in the force of flow and the velocity of flow. However, we're going to have a drop in the volume of flow. We can think about this kind of like a hose, where if the hose is uncapped by a spring handle, we have nice fluid laminal flow going through there, where we have a large volume but a very low pressure. However, as soon as we put a nozzle on the hose, the amount of pressure increases, but the actual amount of volume that flows through the hose decreases. One of the ways that we can look at these fluid dynamics is based off of blood pressures. Blood pressure is the pressure of blood during the heart contraction. It is not what we typically think of as blood pressure. What we think of typically as blood pressure is the actual compressive force necessary to collapse the artery that we're measuring. Generally speaking, it is related to the peripheral resistance within the single vessel that we are looking at. We typically look at it based off of an arm, in which we look at either the right or the left arm. Because of the branching dynamics of the vessels, the more branches we have, the lower the pressure there will be within the individual vessel that we're looking at. Because the left has less branching than the right, we will see a higher total pressure in the left relative to the right. The blood pressure itself is the hydrostatic pressure that we are looking at between the fluid pushing back at the lumen of the arteries and the veins. Because the artery has a compressive force to it, the arterial side will have a greater pressure than the venal side, because the venal side has no compressive nature to it. One of the ways that we can look at these pressures is based on what's known as a pulse pressure. The pulse pressure is simply the difference between the systolic and the diastolic pressures, meaning how much pressure will the fluid exert against the lumen between heart contractions. The other way that we can look at it is based on what's referred to as mean arterial pressure. Mean arterial pressure is MAP, M-A-P. It's basically the difference between the diastolic pressure and the pulse pressure. So we can mathematically look at it as dP, diastolic pressure, minus 1/3 of the pulse pressure, pp. Please note, we cannot directly measure without surgical incision and surgical insertion of a central line